So what we're looking at is this so-called radiation vaccine concept, where we're using radiation to stimulate neoantigen release in order to function like a vaccine and try to get the immune system to recognize these antigens and target other tumors that the radiation itself didn't target. And so what we did was we looked at patients with relapsed refractory Hodgkin lymphoma, so patients who were adults who had progressed through at least 2 prior lines of treatment, so more aggressive Hodgkin lymphomas. And patients received Nivolumab, a PD-1 inhibitor, and if they had less than a complete response to Nivolumab, then they would receive low-dose radiation, 4 gray times 2 fractions, to not every site of disease. So we would leave at least one site of disease untreated with radiation to see if the radiation would stimulate a response from the immune system to target these other sites. So we closed this trial early. We ended up accruing 7 patients. Practice patterns at our institution changed, and so the medical oncologists at our site ended up treating these patients differently. But among the patients we could analyze, the first patient did have a complete response to Nivolumab, so did not require radiation. The remaining 6 patients had less than a complete response to Nivolumab, and so they received radiation. Among those 6, there were 2 patients who seemed to have an out-of-field response to radiation, so something that didn't receive radiation, that was not responding to Nivolumab. After doing the radiation, another spot ended up responding in 2 patients. So 2 out of 6 patients, 33%. It was not as high of a number as we would have liked to see, but what was very interesting to us is the 6 patients who received radiation, all 6, the spot that was treated with this very low dose of radiation, all of them ended up not progressing at that site that was treated. And so with a follow-up of about 17 months, all of those patients didn't progress where the radiation went. And so this was very interesting to us because it told us that when Nivolumab is on board, very low doses of radiation can control the sites that we treat. I think the key next step is to see if it makes sense to treat more comprehensively with radiation. So if these doses are so low that they're safe, and they seem to control what we're treating with radiation, I think the next step is to see if we can treat more extensive disease with radiation and see if we can really control everything that we can see. I think that's it. We have an ongoing trial that's looking at a similar concept, this radiation vaccine concept in non-Hodgkin lymphoma. So these are patients with relapsed refractory non-Hodgkin lymphoma, adults, and they can include patients with diffuse large B-cell lymphoma, mantle cell lymphoma, other non-Hodgkin lymphomas, who have not received CAR T therapy or who have received CAR T therapy and ended up progressing. But cutaneous T-cell lymphoma patients are also eligible. And so these patients receive 20 gray and 5 fractions of radiation, so a medium dose of radiation, and then they receive pembrolizumab at the same time, another PD-1 inhibitor. And our aim is to increase the response rate versus radiation alone or pembrolizumab alone. So that trial is recently opened. We're just accruing our 4th patient now. So hopefully in a year or 2 we'll have some data to report.